Good morning, everyone. We're about to get started, so if you could please take your seats. We are live streaming today, and so we want to start the live streaming portion on time. And thank you very much. For 8 a.m., you guys really got organized quickly. Thank you so much. So good morning. My name is Nicole Bell. I am really honored to be the executive director of the Cambia Grove and to steward this wonderful resource for the greater Cascadia region. For those of you who haven't been here before, the Cambia Grove's mission and purpose is to raise up an environment of healthcare innovation in the greater Cascadia area. Cascadia is, for those who that's a new term for, is basically from Oregon up to Canada, and it goes a little bit east too into Idaho and whatnot. It's our background, it's our home as a company, and it's an increasing destination for healthcare innovation. But there are a few things that we've noticed that our company has figured out that we can do and take action around transforming healthcare. We're on a mission as a company and at the Cambia Grove to transform healthcare, to catalyze a new healthcare system, and what we want to affect change in two specific areas, and that is to reduce the overall cost of care in the United States, and also to help us reorient the system so that people are at the center rather than institutions of healthcare today. And so what we do here is convene people in healthcare who consider themselves healthcare innovators. And so congratulations if you're here today. I think you probably consider yourself a healthcare innovator and are also here to affect change in some way. So beyond convening people in person, we also start to notice things around social media. And so today's topic is really around this piece that we noticed. And today's healthcare leaders, for the most part, we believe, don't meet often enough around the table with young businesses, entrepreneurs, and startups. And so at the Cambia Grove, our programming is designed to do that. We also believe this is true in the online space. The leaders of healthcare of today are not meeting around the virtual space often enough with young companies, entrepreneurs, and startups. And so in order to kind of figure out around some of that disconnect and our observations in our about 18 months of existence at the Cambia Grove, as we've seen our groundswell of followers on Twitter and LinkedIn and other social media aspects, we're kind of noticing that we've got a lot of the young businesses and innovators, but we have some work to do around today's healthcare leaders. And so today, let's see what we can do about that. So to connect with Cambia Grove, if you're not connected already on social media and you have a Twitter account, we're at Cambia Grove. And it's up there to make it easy for you. We also have a Sasquatch in residence. His name is Tiny. He's over there. Beyond taking selfies with Tiny, his real mission in life is to voice the customer, the end user of healthcare, in dialogue with our community. And so we encourage you to connect with Tiny on social media as well. We're live streaming today, and so we've got a lot of people who are watching what's happening here. That will go onto our website, cambiagrove.com. If you ever want to see it later or pass this on to folks you know. And finally, just one more public service announcement. If you are on social media or seeking to be on social media and connect with people who are here today, feel free to write your Twitter handle up on the chalkboard here. We've got a starter set for you of people that you can follow on Twitter and become part of the dialogue. So with all of that, I'm really happy to introduce Jeremy Solly. He is up from Portland today, and he is the person powering a lot of our healthcare leaders at our company in our knowledge of social media. And so I credit anything that we've learned personally at the Cambia Grove to Jeremy's work. And I know a lot of the other leaders at the company would feel the same way, that he's really opened our eyes to the possibility of social media. And so without further ado, Jeremy, thank you so much for being here today.
Thanks, Nicole.
All right.
Hi, how's everyone doing? Thanks for being here this morning. David's going to help me get the slides ready here. So like Nicole said, I'm our social media manager at Cambia. I have the pleasure of helping everybody, our brands and the people at our company get on social and be part of the dialogue and the conversation. So I'm glad you're all here today, and I'm excited to share with you a little bit of what we see happening in the industry and how we can help, and then also turn it over to some real healthcare executives that are out there doing it, and learn how they are using social media. So, okay, thank you, David. Looks like I'm ready. Oops. Oh, there we go. Okay, so. So I think maybe a lot of people have seen this before. This isn't anything new. It comes out once or twice or 5 times a year. And this is what happens every 60 seconds online today, right? So there are almost 1 million swipes on Tinder. Amazon makes $222,000 every 60 seconds. There are almost 10,000 tweets with emojis in them sent. And we stream almost 90,000 hours of video on Netflix every 90 seconds. So I think it's safe to assume that this is where people are, right? This is where consumers are. And I think as healthcare continues to move into a much more consumer-centric space, this is where a lot of the conversations and the people we're trying to talk to are. And our employees are there too, right? So the people that we work with every day. So this is, I think it stands to say, this is where we need to be and need to be connecting with people. So how do executives do that? How and are executives doing that right now? So there was a report on the Fortune 500 CEOs, and who of those 500, 501, because there's one company with a co-CEO, are on social media, and there are about 39% of them are on social media. That's up 7% from 2014. Most of them, LinkedIn is their gateway drug, right? That's how they start. And some of them personally are on Facebook and on Twitter. Instagram, unfortunately, is a sleeper channel for them. And really, out of those 39%, most of them are really only on one channel. Some of them are on 2, 3. There's 2 people, the CEO of Expedia and Mark Benioff of Salesforce, that are on 5. None of them are on all 6 of the major networks. There is one interesting trend we're seeing, though. There's only 2 that have a YouTube page, but 41% of them appear in their brand's YouTube videos. And I think that this was an interesting trend because it really does speak to the power of media on social media. It's more than just the word, but also the visuals and the videos and images that go with it. So, So why do we participate in social media other than to connect with consumers? It's really about building trust. And I refer back to this report a lot. I may sound like a shill for Edelman here, so but Edelman does a great job on producing their annual trust barometer. And there were 2 pieces of this year's trust barometer that were really interesting around CEOs and around the healthcare industry. So one thing is tough is that people feel that only 61% of people feel that the healthcare as an industry is trustworthy, and then even less think the CEOs in that industry are trustworthy. So I think that there's some room for improvement here, right? There's an opportunity. But the good news is that really trust is rising, and trust in CEOs particularly are rising over 2015, 2016. And as CEOs are building trust, How do they do that? What are the specific things that CEOs and executives can do to build trust? And so when people were asking what is important for a CEO to do, communicate with employees, meet with investors, participate in industry conferences, all the things that I think a lot of us are doing. And I also think it's interesting that the last one on there, 57% of people feel it's important for a CEO to share their views on social media to build trust. And so as CEOs and executives share on social media, they build trust, they hear the views of the consumer, what will that get us? What's the result? What's the ROI, right? I hate using that term, but that's pretty standard, right? Like, what am I getting for doing all this social media? And the other piece of this, especially for the healthcare industry, if you look at the audiences that we talk to on social media, more than just consumers, we also talk to our employees and our fellow colleagues. Employees, this is the impact of a social or a trusted CEO, right? So as a CEO is engaging in issues and becomes more trustworthy, employees, there's a 23-point bump in them recommending their company as an employer. There's a 14% point bump in recommending products or services to other people. I think that's pretty powerful. I think that that's something that if I'm an executive, I would want to do, and I would want to have my employees out there sharing that. And I can only imagine the bumps that this would do also for our consumers and people, the general population. So this is the landscape, right? This is kind of the overview of where executives are using social media and the opportunity there. And so what I want to get into now is how are they doing it? And so we have 3 awesome local healthcare executives that are going to come up and share what they're doing on social media. So I'm going to bring them up right now. We have Dave Chase. He's managing partner at HF Quad Aim Fund, thank you. Jennifer Lawrence-Hanscom from the Washington State Medical Association, and Don Antonucci from Regence BlueShield, Washington here. So come on up, guys. And I've got some questions for them, and then we will also go open this up at the end for some questions from the audience. So please, as they're answering, I'm asking, they're answering. Be thinking about what you might want to ask them. What have they missed? What haven't they covered? Really, what we've asked them to do today is go in depth about what it is they're doing. How are they doing this on a daily basis, so that you guys can hopefully come away with how you can also participate in social media. So, do you guys each want to give a quick intro of yourself and tell us what are the social media channels you are on as well? Dave, do you want to start?
Okay.
There we go.
Okay.
Excellent.
I thought with a social media thing, you sent the list of questions, and that was the bio. And I thought, well, my Twitter bio is my bio. So 140 characters.
And that's what we used here today.
Yes.
How about that?
So that was very handy. You saved me time. So that's pretty much my bio. My day job right now is being a VC, micro VC fund that we're just spinning up. And then in terms of the other things I'm doing, my night job is working on a film, which is referenced there. We'll call it The Big Heist. But basically, I've been an entrepreneur, had a recent exit a couple years ago to WebMD, went through the integration, left there about a year ago, and started some businesses inside of big companies that grew nicely. And so that's kind of my background. In terms of the social media I use, by far Twitter is the one I use the most. Definitely use LinkedIn, tiny bit of YouTube, tiny bit of Snapchat, and Instagram. And then Facebook has pretty much been personal, and I'm kind of torn. I'm like, God, I get a lot of business requests there, and that's kind of how it started, and I'm kind of thinking I'm just going to go that way, but I haven't totally gone over there yet. So I think that's what you wanted.
Excellent. And you can chase Dave at Chase Dave.
Yeah,
I really like that Twitter
Chase
handle.
Dave for everything. Skype, Gmail, Twitter.
Excellent. Jennifer?
Hi, I'm Jennifer Hanscom, and I'm the CEO of the Washington State Medical Association. And so for those of you who aren't familiar with WSMA, we represent physicians from around the state of Washington, as well as physician assistants. We've been around since the 1800s, so a long-time company. I am on 5 channels, 3 professionally, so LinkedIn, and it's very intentional, and I can get into that a little bit later, but LinkedIn, Facebook, and Twitter are all my professional channels. And then personally, I am on Instagram, and then of course Snapchat, because I have 3 young boys, and I have to pay attention to what they're doing.
You've got to monitor that activity. Yeah.
Awesome. Hi, Don Antonucci, President for Regence BlueShield here in Washington. Been with Regence and Cambia for about 6 years and been in the insurance industry for about 22 years now. And the number of channels I'm on, so I'm on LinkedIn was the start, Twitter, Facebook, and also Instagram I'm on as well, Google Plus, a little bit. So those are the main channels that I participate on, and how I think about it, and I think what we'll start to hear, it's different for each person. I view social media as an art and a science, and you have to have a personal philosophy around it. I actually combine it both personally and professionally, but I think of it in terms of percentages. So my LinkedIn is 95, 100% professional. Facebook is 95, or 80% or something like that personal. But I try to combine those together.
So next question, let's go back to the origin. What's the origin story? When did you start on social media? What was your first, and Don, why don't we start with you since you got the mic. What was the first channel you were on? Why did you get on it? What were you doing? And you could either talk about the first channel or more recently, like when did you start with Twitter or something to that effect?
Yeah, so the first channel I was on, like many of us, was LinkedIn, and I'm not sure when that was, probably at 2007 or something like that. And I remember going on that and talking to some other colleagues and executives about it, and they're like, "Oh, I'll never do that. That's crazy. Why would you do that?" And I just thought it was brilliant because why wouldn't you do that? It's an online Rolodex, right? Instead of having a business card and then following up where somebody else went to or worked, you automatically had a Rolodex that just updated itself. So that was my first real interest in the social media side of it. And obviously, LinkedIn has continued to just increase its functionality and use, but it's a great tool. And I think back to some particular executives, colleagues that are still at a very high level today across the country, and the same people that said, "Oh, I'll never be on that," are the ones now on that and using it to their advantage. So that'd be the first one I was on.
So my experience initially was personal, and it was Facebook. So, way before the movie came out, I can remember my husband sitting in his chair saying, "There's this really cool website where you can get in touch with people from back in your elementary school days." And I'd put it off and thought, who wants to do that? And so that's where I started originally. I shifted and don't have a personal Facebook account anymore because I wasn't... once you become CEO of a company, you want to be careful about information that's out there from your high school days. So I was very intentional about closing that down, as Lisa knows because she went to high school with me. So in 2009, I wanted to build up my presence as a new CEO in the community and to add a voice to the healthcare conversation outside of my company. And so it was a great way for us through Twitter and LinkedIn and then Facebook to really elevate our brand as an association and then my brand as a CEO in the community.
Yeah, I don't know if it counts, but I think of my start in social media being blogging, and that I got onto that early, even though it's kind of funny now, some people think of me as a writer, and I hated writing. That was torture. That was my worst subject, but I thought I saw this blogging thing come along, and I was like, I kind of learn by doing. I got to just kind of get into that, and then bit by bit, you found, oh man, somebody's reading, and I better pay more attention to what I write. And so that was probably 2000-ish, pretty early. And then, like everybody else, the experience was probably 2007. I was doing a lot of digital marketing type of work, and in that industry when I detoured away from healthcare for a while. And so LinkedIn and Facebook, and then shortly after, Twitter all kind of came in the mix. And initially, Facebook was purely a business thing. And then the high school wave came in, and then the college wave came in, and it's like these different waves of people, so it's a total jumble now. But yeah, it was around that time frame, and then just bit by bit, you realize what works for you and what's compelling for people or not.
What was your first blog about?
My first blog, I think it was about, I worked on this thing called Microsoft Sidewalk that ultimately became part of CitySearch. And at one point, Steve Ballmer said that was his one regret, that he let that go. And I think Microsoft would be a much better place in terms of its digital business had it not done that, and had, you know, sort of in my mind, kind of the best and worst of times of Microsoft, of how it kind of went from a scrappy, you know, let's change things, to more of a bureaucratic environment. And this experience kind of captured that experience, or that story kind of captured it. So I wrote that out. I think it was on Blogspot.
Okay, so you're all in healthcare, and you're using social media in healthcare. What, Jennifer, let's start with you this time. What value did you see when you first started doing social media and being an executive in healthcare? What was the value? What was the trigger of, like, I really want to do this in the healthcare space? Like, did you see a conversation, or what are the value that you're driving?
Yeah, you know, the value for us as a medical association is to have a real-time conversation with a variety of different audiences in a space that people are gravitating towards. So, you know, we traditionally send out a newsletter, or then you send out an email. Well, this is about taking all the information and the work that we do as a medical association and getting it into the hands of a variety of different audiences, real-time, when it's relevant to them and when they're looking for information. So it was that value of that real-time conversation, that real-time feedback, and again, being able to get your hands on information from around the nation in terms of what's happening in healthcare and what's trending. So really being relevant in terms of real-time news. You know, I think the challenge is you can get a lot of information, right, through the flick of your thumb. Like, I wouldn't have known today was National French Fry Day if I hadn't checked my Twitter account this morning. So, you know, I can see what's trending in JAMA, what's happening at the American Medical Association, what's going on with an insurance company in New York, you know, really quickly at the start of my day. But am I getting deep knowledge about what's happening? No, you know, I'm just reading 140 characters. But it gives you a big swath of information all at once.
Yeah, I would just add that it's definitely a major source of news for me, and going through that and looking at the Twitter feed and social media. It's also a way to really listen and connect with people. And so I've kind of come up organically over time with sort of my rules of engagement, how I work that. But I've made some just fabulous connection points that I would not have made if it was not through social media. And some of the people I've met in person that I never thought I would meet, and some of the people I haven't, but I feel a real connection to them and have learned a lot. So I think it's a great way, especially with a company like Regence, who's part of Canby, you're focused on the consumer. What better way to be in touch than really understand what's happening in a market and happening with people out there?
I'd say a few things. I think one of the things is humanizing an organization and humanizing yourself. I mean, at least myself, I kind of, you know, got all the media training and knew how to do the corporate speak, and that doesn't play so well. And I think it's one of the things that hasn't fostered trust. So I think humanizing organizations, that's helpful. I think it relates to your slides on building trust. I think another thing is breaking down silos. If I think about the first half of my healthcare career, you know, sadly, I had very little interaction with doctors, as an example. Now, I mean, the main folks, you know, even though I'm not on the clinical side, the main people I interact with in the social media realm are doctors. And so I think it's been really good at sort of breaking down some of those silos. And then, you know, also in terms of value, in terms of keeping up on what's going on in the industry, has just been an incredible tool for me. I mean, over my career, I've used, print newsletters and industry magazines and, email newsletters. Nothing has come remotely close to how much value I've gotten out of Twitter in terms of keeping up on what the latest is going on. Now, I've put a lot of effort into it, and I am an oddball in terms of how I use Twitter. I have this self-imposed limit of 100 accounts that I follow, so I'm constantly weeding and feeding. And I mean, there's people that I'm actually industry friends with. I like them, I agree with them, but they go off on political rants, and it's like, that's not what I need there. Yeah. And so, some people take offense at that, and I apologize if I'm not following them, but I just have this thing where I want it to be extremely high value, and that's what's made it very high value for me.
Good. Let's talk about effort. Let's go into that conversation of, so how much time are you guys spending a day, a week, a month on social media? How are you carving out that time? And I want to start with, how do you curate a list of 100 people that you follow on Twitter? That's a pretty noble pursuit.
Well, in terms of the amount of time, I would guess that probably all of us will underestimate the time we spend, because I was looking at it, I was like, maybe hour plus, and it varies, but there's probably a couple times, maybe 2-3 times a day, generally when, like, I'm having breakfast. I mean, I used to read the morning newspaper. That was, to me, like, brushing my teeth and taking a shower was reading the morning newspaper. That's pretty much Twitter now. And so during meals, sometimes when I'm not, obviously meeting with somebody, and then just little random breaks, at the elevator and, waiting for a bus or, whatever it might be. It's those little snippets. So it's probably an hour or two a day. But it's been well worth it in terms of the value. And then in terms of the curation and how I follow people, it really just is, I kind of started out that way, and there's certain people who are just incredible about what they put. I mean, it started with blogging. Like Brad Feld's a venture capitalist blogger, and I looked at the people I followed initially on blogging, and I looked at it as, they were reading 100 things and sharing one, and so they were filtering for me, so I'd hope I can be a filter for other people, but then that's the people I followed. And almost every case, my decision to follow somebody was somebody I would see being retweeted a bunch, like, oh, that person must be saying something interesting. And then when I hit that 100 limit and I'd see somebody compelling, I'd look at their Twitter streams, like, oh, that one looks like worth following. I'm like, oh man, who do I drop? And then I just go through, and it's like, I can't remember this person that I've retweeted or found something incredibly compelling from them, and so they drop. And so, again, I'm sure I piss off some people on that, and I know there's a list and other things, and it'd probably be more socially acceptable for me to do that, but I just kind of felt it was not authentic and not, I don't think anybody can follow 15,000 people or whatever, and so I felt that was inauthentic from my standpoint. So that's kind of how I've done it.
So if Chase Dave follows you, be authentic and provide him valuable content. All right.
And I mean,
Noted.
go to that list. Don't follow me. Follow the people I follow. And if I show up in their feed, then maybe follow me. But it's a great list, and it's an ongoing thing, so I'm sure there'll be other people who will get added to it.
Dave has done the work for us. Follow his list, all right?
I'm going to do that
All right,
today.
Jennifer.
Yeah, so definitely you have to build it into your schedule. I mean, like regular check-ins with your staff. You have to do regular check-ins with your channels. So similar to Dave, I use any random moment. So first thing in the morning, check all my channels. Twitter is really easy to check if you have a phone in the elevator. I do a lot of activity when I'm on a plane because my time is kind of focused there. So you'll see me, if you follow me, you'll see moments where I'm doing it a lot, and then you'll have some dead time probably really busy. So you have to be intentional, check it in the morning, check it in the afternoon, check it in the evening. I don't always post something. I want to have something relevant to say if I'm going to post, or something relevant that's going on in my organization. But I check it frequently. So, and I think you have to.
That's good. I would say my time on social media varies significantly day to day. So there's days where I maybe spend 15 minutes on it, and there's days where I'm probably going 90 minutes on it or something like that. And the reason for that is if I've got pockets like we've talked about in the day where I'm heading somewhere or I can take a look, I'll look at it. And also notifications are a trigger for me too. So if I see the notifications popping up on something like an event like this where your Twitter handle's getting hit, you want to go in and interact with that and see that. So I do it more organically that way. LinkedIn, same thing. Is somebody viewing your profile? Are you getting a request that's coming in? And so I'll use moments in the day to do that. And then I also think about it in terms of, content on the different channels and what's relevant. And so I'll think about, all right, am I doing something or am I seeing something that I want to share or put out there? And that would be a trigger to go into social media as well.
Sure. So before I came here this morning, I scheduled a bunch of tweets that went out on hashtag Cambia Grove events. And so if you guys are looking for any of the stats that I shared earlier, I shared all of those resources on Twitter. You can check them there. Do any of you guys have a habit of, okay, every Sunday night I sit down and do 30 minutes of scheduling some relevant tweets this week that I think are really important? Or do you use any tools or scheduling tools to help keep kind of those conversations going and put out that valuable content that besides the organic piece? I think we're all working on that and doing that in those 15 and 5-minute elevator rides and stuff. But is there anything you guys are doing that's a little more planful?
Yeah, I think of it in terms of systems and processes, right? So like Dave's got his, what's interesting about social media is that I think people come up with their own rules and a way to operate based on what they're trying to accomplish and what they're trying to do, right? So I'm following, I think, 2,200 people on Twitter. For me, that's okay because when I check news sources, I go right into the handles that I want to look at and view. But I do have systems and processes that I use. So for example, on LinkedIn, especially coming new into the market in Washington, every time I got a business card from somebody or every time I met somebody in the market here when I first got here, they immediately got a LinkedIn invitation from me so that we could connect and have that connection point. And then there's times that those relationships then move over to whether it's Facebook or Instagram or whatever, based on how it works. So yeah, I would say that I do have a bunch of systems and processes that come up. So one thing is we have a great strategic communications division here at Cambia and Regence. So every Tuesday, somebody, and she's sitting in the back there, sends me a list of really interesting articles that I should take a look at. So what I do is I'll read it, and if there's something that's interesting that I want to share, and I don't share it every single one of them, I'll put it out there onto Twitter or LinkedIn or something like that. There's something you've shared, Jeremy, a tool called VoiceStream that we have inside of Cambia that actually finds content and employees can put it in and be able to share it, and it allows you to go in from that app and share out to LinkedIn, Twitter, Facebook, whatever you want. You can select which channels it goes to. So I do have different, I don't have them all listed out for me. I don't sit down Sunday night, but what I do is I go to certain tools and I have certain things being pushed at me that I then review and then share out.
I started with Hootsuite, where I could get messages out into all my platforms. But I moved away from that, and I just really approach it organically when I have something to say or want to push something out. I try to coordinate with our social media staff person, to use the proper links and the proper feedback channels into our organization. But I try to be more strategic in terms of the audiences that I know are following me. So for instance, on Facebook, we have a lot of our physician members there personally. And so I'm trying to make that personal connection with them, but also share some of what WCMA is working on with them. On Twitter, it's about raising and elevating the brand of our organization with the media, with policymakers, and with others, influencers and stakeholders. And then with LinkedIn, a lot of physician leaders, a lot of system CEOs, medical group CEOs are there. So again, trying to be in their space, talking to them about relevant issues that the Medical Association was working on that relate to them as professionals. So it makes it hard to use tools to kind of populate. I mean, I think that might create more work for me, but I'm open. Again, I'm learning this as I go, so I'm open to thinking about new solutions. And I've learned a lot here just listening to Don and Dave, so things to try.
I would say one of my key starting points is, and this is also kind of answers the question of where the heck do you find time? And that's what I get from a lot of people, and especially when I was, CEO of a startup, like, shouldn't you be like doing your CEO stuff and not wasting your time on social media? And I said, if a customer calls you, will you answer the phone and talk to them? They're like, oh yeah. I was like, do they ever ask the same question? More than once, across customers? Like, yeah, of course. So we all have this FAQ, and I'm kind of an efficiency freak. I'm like, why answer it, hit the replay button 1,000 times? Why not just come up with a crisp answer? And sometimes that might be an article, sometimes that might be a tweet, and somehow when it's up on, I write for some third-party publications in addition to LinkedIn, and somehow it has more credibility when it's on there. And that was particularly helpful when I was in a startup. So I'm a big believer in sell your category, not your company, and you're going to get more than your fair share of that category, because most people don't really want to hear the chest thumping from a company. That gets pretty boring. Most people will mute that. And so the trick was just coming up with, how are the questions I'm getting relate to some trend in the category that I can speak hopefully somewhat intelligently about, and then often write about that. And sometimes I would build up, and then it would be like, I wake up at an absurdly early hour, so like, 4 on Saturday morning, I'm like bang out a bunch of stuff. It might be a few posts, and then I'll just I'll use Hootsuite as a tool to kind of schedule tweets out related to what I do. So it kind of trickles it out. So it's not just like everything just coming in at one 30-minute burst when I've finally gotten done with stuff. And so that's been helpful. And that's probably the biggest thing, is just, you can listen on social media, you can listen with people, and I just try to listen for those recurring themes. And, it was one of the pieces of advice that I read from Fred Wilson, who's another well-known VC blogger, is even if nobody reads what you write, it does force you to crystallize your thinking. And so I use that, and, I can babble, endlessly and write endlessly. And so hopefully I get a little bit better on that. So that's kind of been my routine.
Great. So we've talked a little bit about the time that it takes to do social media. Did you guys do anything to justify that time investment? We know Dave got rid of newspapers, sorry, print media. What's the sacrifice? What's the thing that you either taking away, or what's your thinking around how you're justifying that time investment that you're now making, that maybe you weren't before 2009, according to, well, in 2008 in Dave's case, when you joined Twitter, or when you joined social media. So yeah.
Yeah, I think I pretty much spoke to it, so I think I'll pass the baton to Jennifer.
I don't know that it required me taking anything away. I mean, I think it's part of your job as a CEO to be kind of an external face of your organization. And so this is a vehicle for doing that and getting out into relevant conversations and spaces. So I think it's part of the role that you play as a CEO of an organization to be out in that conversation.
Yeah, I agree. So I would say it's actually created time for me. So it's expanded reach. It's actually expanded my intelligence of people and things, actually, from whether it's recruiting talent. I mean, I've hired people because we've had a connection based on social media. I've provided consultants and others to do business with other companies across the United States because we've had a connection through social media. I've been able to track their work over time and think highly of them. So for me, it's expanded time, and it's expanded the resources and influence that I have access to.
Yeah.
The other justification is, particularly going back to when I was in a CEO role, other than having a fantastic team, which was critical, particularly a technology team, at the end of the day, every good thing that came to our company, from fundraising to press to customers to ultimately acquire, every one of those came as a direct result of the writing and tweeting I was, social media stuff I was doing. It was all coming back to that. That's how they knew about me and knew about us. And I'm sure there were other companies doing great stuff very similar to us, but they were under the radar. And so they didn't get a seat at that table and didn't get that. And so, ultimately I became a big believer in this when I was doing a lot of consulting and kind of acting executive roles with young companies. And it's just simply the most cost-effective lead generation tool I've seen. It's a long game. You got to be committed to the long, because it's not an immediate gratification like buying a Facebook ad or something like that. But it's incredibly cost efficient. I mean, the history of relatively short history of Avado, our total marketing budget, if you don't assign any value to my time, was less than $5,000. And during that time, we probably had more visibility than just about any startup out there. And even, in fact, the matter, other than public, earnings reports, we had more visibility than WebMD, the company that acquired us. So it was all, to me, that was a very easy justification, and it was sort of a vindication as people would, I'd get some pretty harsh comments, and people who, thought I was just completely wasting our company's resources and time doing that. And so, I felt vindicated ultimately, but it is interesting the blowback you get sometimes.
So that was kind of your ROI, right? Like you saw the return on spending the time doing social media. What and I'll open this up to everybody. What's your measure of success? What are the ROI? What are the metrics that you guys are looking at? Are you looking at any that show you that you're doing it right or that it's worth your time? You obviously just kind of gave us a good example. Are there any other ones that you guys are looking at on a weekly, monthly, yearly basis?
I really am not looking at any metrics. I want to see that my followers are increasing. I want to make sure that I'm part of relevant conversations. Part of it for me, even though I've been on it since 2009, probably more active recently, is just, am I showing my personality through the information that I'm posting? So I try to do a mix of professional and personal, but it's also putting yourself out there in a way that you can feel a little bit vulnerable. And for a CEO like myself, in an organization where I'm trying to draw people to my organization, it can be challenging to be provocative because you don't want to step in it. I'd love to say, hey, Ruth Bader Ginsburg, good for you for saying that, but then I will have a physician in Spokane call me and say, what are you doing? So, I have to be careful about what I say, and I hope I get more comfortable so I can be more provocative. And then I think at that point in time, we'll look at the tools and in the dashboards and feel more comfortable that I'm developing a metric. But again, I'm just trying to get comfortable in the space.
Mm-hmm.
Yeah, that's good. You make me think of somebody I'll follow every once in a while is John Legere from T-Mobile, who's got like 1 million+ followers. The guy, what he's able to talk about and say out there obviously would be very different than what we'd be able to do. But it looks like he has a lot of fun with it, and he's done amazing things with the brand at T-Mobile. So for me, for metrics, it's one of those things where I kind of look at it and I go, you know what? Metrics are important, but they're not important. But there is an in-between ground. So if you're not increasing your LinkedIn connections, if you're not increasing your Twitter followers, that's probably not a good thing. But then the flip side is having 1 million followers that you purchase a list and bought that don't engage with you versus having 500 that you do engage with. You have to look at the advantages of actual engagement. So I don't think there's an easy answer to it. I look at it as more trends. If you're trending up, that's probably a good thing. But I don't have any specific targets like I got to increase my followers by this or I got to do that. But I do want to see it gradually continuing to grow. And then I look for my ROI is really in those interactions that I have where I can see either I've hired somebody or it's led to some result, or there's been a new connection that's been made through social media, or I've learned something that I wouldn't have without it. For me, those are gratifying to see that, and I've got a ton of those stories and opportunities.
Great. So I'm hearing a lot of kind of qualitative results that you guys are seeing, and I think that's good. And I really liked, Jennifer, how you talked about vulnerability. So can you guys think of a time, you've been active on social media, each of you, for 6, 7, 8 years now. Can you think of an instance that sits out in your head where either there was that really great interaction, or even one where you felt really vulnerable and exposed that maybe wasn't such a great interaction that you maybe learned from? I'll start it off. I have such a softball for you guys. One thing that sticks out in my mind, I've been on Twitter for as long as you guys have, and one time I was in New York, and Sarah Jessica Parker was sitting next to me eating a steak, and I tweeted about it, and she tweeted me back, and I thought, and like right now that sits out in my head, right? And so that's one of those moments that you are like, wow, that was a really qualitative like win for me, right? And so what were those, right? Even though yes, I watched Sex and the City, but besides that, it's like, what am I gonna do with the interaction with her? But it still sticks out in my head. What are those moments that stick out in your guys' head, whether they were good or bad, where you felt really vulnerable and exposed?
Well, I'll give you a couple good ones that I just think back on that are kind of interesting. So early on when I was on Twitter, one of the management gurus that some of you may have known and follow, that I've read a lot of his books, In Search of Excellence and others, is Tom Peters. And I just have followed him for a long time in my career, and somehow we ended up connecting on Twitter, and he ended up following me, and so we've had different exchanges there before directly. Another one was I read the book Blue Zones by a person by the name of Dan Buettner. And if you haven't read that book, it's a great book. But it's so he's somebody that I really liked the book. So I actually shot him a note on LinkedIn and said, "Hey, read your book, loved it." We connected on there. What was interesting though is that a year later, somebody in Oregon had said, "Hey, I see you're connected on LinkedIn to Dan Buettner. Do you know him? We'd like to bring him to speak at a conference." I don't know Dan Buettner other than that LinkedIn connection, right? So I sent him a message through LinkedIn, explained the situation and the opportunity and what it could be. And he said, "Give me a call on my cell phone." We talked, and he ended up coming out to Oregon. I'd seen him since there, and we've made a connection now, not just on LinkedIn, but we're friends together on Facebook from a personal basis, and we know each other. And that's just kind of cool to be able to go from, without social media, there's no way I'm having interactions with those folks, and there's no way he's able to go do a presentation at a conference, which has led to now 3 other events that he's done in the Pacific Northwest. And it actually really was the beginning of a project that we've done with Blue Zones at Cambia. And so those kind of things are fun.
Yeah.
Yes, my one brush with fame was the author behind Concussion, the movie Concussion.
Okay.
We were going to a conference together, and I had watched the movie prior to hearing him speak and had tweeted about that, and he replied to it and retweeted it. So that was my one brush with fame. I learned about privacy controls with my Instagram when Rob McKenna started following me. So I realized I needed to lock that down because that's my private account. But outside of that, I haven't had a good or bad experience, which makes me question whether or not I'm being provocative enough.
Timely, because yesterday, on the high note, I just written a piece, just kind of banged it out really quickly, and after the tweet, I was like, oh man, I better go copy edit this thing. But Andy Slavitt, who's the acting administrator for CMS, that runs Medicare and Medicaid, I published a piece, I think it was yesterday, that was basically talking about the importance of physician engagement in order for Obama's administration to reach their health reform goals. And so he tweeted at me, I hadn't tweeted at him or anything, hey, something like, that was a really valuable read, appreciate it, send it around to the administration. So like, oh, that's cool. And so, and there's been some of those where, I try to be provocative. I got a point of view on where I think the industry can and should go. And I get some nice responses there. I wouldn't say that I've had too many negative stuff. I mean, periodically I'll get, trying to think. Occasionally you get a hater, saying you're a self-promoter or something like that. But fortunately I haven't had too much of that. It's like he was accusing me of self-promoting an open source thing that I'm giving away. So I'm like, okay, I'm promoting something I'm giving away. That's hopefully
You can't please them all, can
you?
Yeah.
And so, like, okay, you do have to be provocative sometimes. I'm certain that there's a lot of people not on social media who think I'm an idiot and don't tweet at me, and that's okay. But so far they haven't been trolling me too badly.
We talked a little bit about, Don mentioned follower count. Do you guys look at, you kind of look at follower count, and if you do, are there any strategies that you've implied to try to get more followers, or is it really just focusing on the content regardless,
Yeah, I've been it's been pretty organic. There's been some business I've been involved in where I've been very intentional about building follower accounts, and I'm sure we'll do it for the movie, but in terms of my personal account, just been pretty zen about it, and if it's like it's not growing, it's like I'm not adding enough value here. I need to do a better job, but I don't worry about it too much, and it's just sort of steadily ticked up. So yeah, I haven't, as far as business accounts, been intentional. Personal, not so much.
Yeah, intentionally, I will go out and follow people. I've been, we always get asked, people come in and follow us, and if they're relevant to what I'm trying, to the space that I'm in and to what I'm trying to communicate in terms of a conversation, I'll follow them back. But oftentimes, and I've been really disappointed with LinkedIn lately because, you come in every day and you have 45 invitations and most of them are spam. And so that hasn't been as enriching of an experience for me, and I've thought about walking away from that space. But at least on Twitter, you get a mix, and sometimes some really important, engaging folks will follow me, and I make an intention to check that daily and follow people who are relevant back.
Yeah, I agree. I think, with something like Twitter, I think it's a combination of value, but it's also activity. You can have the most valuable thing in the world, but if you tweet it once at 1 a.m, no one's going to see it. LinkedIn, same thing. Because of the popularity of it, it's grown and grown and grown. You get a ton of invitations. So what I do, it's not a perfect system. I accept invites if I know they're connected to people that I know and there's something relevant. But if I can already see that person's going to try to sell me on something, or if somebody comes in, there's times where you do accept somebody and they're like, all right, I want to sell you this, whatever. I won't respond to those, but I respond authentically to anybody that's truly reaching out to me with something of value, or they're curious about something. I respond to those all day long, but not the ones that are just trying to pitch you something.
So let's look a little bit into the future. What are you guys noticing any trends in your use of social media or even within healthcare that you think are coming, or that you wish would come? Like if you had a magic wand, gosh, I wish this tool was here, or this kind of channel was here. What does that kind of future landscape look for you guys?
I'll just give you my view overall on social media. So for me, I don't have a particular favorite tool, right? I think all these tools will change over time. Either they'll get enhanced, or we'll move on and it'll be something new the next day. So I look at it more as like, what are the options out there to be able to use? I don't have a favorite or anything. But I do, but I also look at myself and I go, what are the ones, for example, I'm not active on YouTube or anything like that. There probably is some applications there for video and other things that I'm not leveraging, or that our company's not leveraging in the big ways as we could, but you got to think about what's your strategy with that, what type of value you're trying to add, and how would you do it. So just kind of always taking a step back, looking at what you're involved with, what you're not. I think the flaw would be to get too comfortable with any one thing and be like, for me, in terms of my philosophy, in terms of how I use it, doesn't necessarily apply to anybody else. But if I said, I just like LinkedIn, that's what I'm comfortable with, that's what I'm going to do, so what? You should look at the avenues that, again, because my philosophy is I'm trying to connect with customers, I'm trying to listen, I'm trying to learn, so that's why I've picked the tools that I've had. And I'm trying to share and make a deeper connection with other folks on other social media.
Yeah, I don't know what the future holds, but I know there are a lot of tools out there that I'm not even using. You know, Periscope, Google Plus. I mean, there's a lot of platforms, and again, it's just being intentional about where do you want to have a conversation, where do you want to connect, and who's your audience, and why are you there. And so I don't know what's around the corner. I'm sure there's going to be something. I mean, what we were just having a conversation about Twitter not too long ago, extending the 140 characters. While there are days I wish that happened, I'm glad that it hasn't. I've definitely seen the workarounds in terms of the photos and the information that's going out. So
The Mark Andreessen tweet storms.
yeah, yeah. So I'm sure Dave has something.
Well, here's what I'm hopeful for. And I don't know if there's any new tools, but I'm actually pretty optimistic about this. And the broad trend in the industry towards population health and outcomes, I think is going to have a very profound effect on who uses social media and how. And I think in particular, as you remove the distortions of just paying for piece parts, and you remove distortions of you only pay doctors when you see the whites of, they see the whites of the eyes of the patient, and you move into a population health setting, there's a lot of things that are going to lend itself to, again, like I talked about my FAQ. Well, like one of the docs who's done a great job on social media is orthopedic surgeon Howard Lux, and he had the same thing. He gets the same questions over and over, so he just scheduled a 41st appointment or something like that every day, and he'd pull out this high-tech thing called a smartphone, and he'd hit record on the video, and he'd just respond to here's how golfers recover from ACL surgery, here's trade-offs of this, and in a month he had 20, 30 posts. In a couple months he had quite a bit, and that's been very helpful for his business. And it's been incredibly helpful for his patients. It's made the clinic visits much more efficient because a lot of the patients have already consumed this content. And then when you look at the fact that you look at the studies, the sick care system only impacts 20% of health outcomes. There's all these other factors: social determinants of health, social, economic, physical environment, health behaviors, all that. And as organizations take on risk, I think they're going to realize, we need to learn from each other about what may be impacting opioid addiction. That's a big topic right now. That's the sort of thing that I think there's a lot of opportunity for people to engage and get beyond, I think, a real failing in healthcare where knowledge gets shared very incrementally and just kind of tribe to tribe. And versus like, boy, we should all level up on this stuff. I mean, that's a big reason I'm working on this Health Rosetta thing. I was like, this is crazy. If somebody, some doctor in Bulgaria or Wichita has found out how to solve this particular problem, we should all level up on that. And so I think with the millennial generation in particular, that as they kind of age into full practice and leadership positions, I think they will lead the way, just like they did with smartphones, like they did with social media, like they're doing with food. That I think that's going to have a big impact. Whether or not there's new tools, how those tools get used, and what type of professionals use those tools, I think will change a lot.
Great. So I'm going to ask one last question to the panel, and then we're going to start opening up for Q&A. So get your cues ready. What would you guys say is like at least one thing that everybody you'd recommend they go leave here today and do, whether it's on social media for healthcare? Well,
I mentioned one, which was go look at who I follow, because I think that's a great list. So that'd probably be the one thing.
It's very self-promotional, Dave.
Yeah, well, I'll give you my self-promotional one. At the end of any of my articles on Forbes, you can subscribe to my newsletter and do that. But I think the main thing is just get out there and engage, learn the tools. It takes a while, just like anything, whether it's golfing or writing or whatever. Just get out there and do it, and you'll evolve and learn and improve. And I think if you go in with a learner's mind, I think it's easy to go into these things skeptical. I certainly did on some of that, but kind of suspend some of that disbelief and skepticism and find people who are really valuable and follow them and see what they do. I've learned a lot from other people I follow.
So I would say if you don't have an account, open one, give it a try, schedule the time into your day to monitor it, to get engaged in it. You don't need a PR expert to get you started. If my 12-year-old can figure it out, I know all of you can figure it out. And if you have kids, they will help you. But I think, a lot of people are apprehensive about getting started, but you just kind of have to dive in feet first and go for it. And I think you'll be pleasantly surprised.
And if you don't have a Twitter account or a LinkedIn account, and you get one, and you don't put a picture up, especially on Twitter, do not be an egg. Please don't be an egg. When I see that just, it hurts. But I guess my one thing would be, seriously, I think of it in a 3-step process. I was thinking about it for this panel discussion. I think you got to come up first, before you jump on, come up with your why. What's your reason for wanting to be on any social media to start with? At the core, what are you trying to do? And there can be multiple reasons for that. Then pick one or two and learn a little bit about it and try it. And then just kind of evaluate it. And I look at that as a loop and keep coming back to it, because that why will evolve over time as you'll see, well, that's an opportunity, that's neat. But look at it that way, and I think you'll be set up for success.
Great. Thanks, you guys. So I think Molly has a mic.
Yeah.
So Molly has a question first.
I have 2 questions
All right.
from our online chat tool.
Oh, excellent. This is from the interwebs.
From the interwebs. So we are live streaming this, which is very cool, and we have an engaged audience online. And so they have 2 questions, and these questions are pretty well thought out because they had to write them, DJs. The community in healthcare are mostly retweeting and not really pushing the envelope, except maybe you, DJs. What role do you think social media can play in driving real substantive change in the industry, and have you seen any examples that you can share?
I think that some of the folks that are pretty provocative out there, I think, have driven change. I guess for some reason the people who are on my mind right now are Eric Topol, Jonathan Bush, and Zubin Damania, aka Z-Dog MD, which is his Weird Al Yankovic alter ego. And I think that they have been provocative, and they have a point of view, and whether or not you agree with that point of view, and they have very different ways of projecting that. I mean, Jonathan Bush, is the most unpublic CEO persona I've seen. He's very provocative, and I think that serves his company well. I think Eric Topol is certainly pushing the technology and pushing his profession a lot, as is Zubin Damania, aka Z-Dog MD, is also a physician. But I think he's using humor and storytelling and music videos, which is very creative. And you see his evolution, going from very low production value to pretty high production value. And I think he really is making a dent. I mean, he had a kind of an anthem-like music video on electronic health records that I think was a gut punch to a lot of the industry. But it was a different way of doing it. And I think you're only limited by your creativity.
Any other thoughts on?
I just go back to, I don't think about social media as the thing that drives it. I think it's an enabler, right? It's a connectivity. It's, you mentioned some great people out there to follow, but I think it's then using social media to then take things back into the real world and make change. So I gave that example of how I connected up with that Dan Buettner from Blue Zones, who's doing some amazing things in actually the Oregon area right now around creating healthier environments. So I think it's all good as long as you take things and are able to move them forward to action, and I think that's what's important.
I think one thing that I've seen with this as well is as you practice and get more comfortable with it, then your voice starts to come out a little bit more. And I think that that's important because I think you see a lot of people retweeting and there's a little bit of maybe a shyness and when going into it. But then at the same time, you have those aha moments where I reached out to Dan and lo and behold, he responded. Wow, and so I think as you get more comfortable with it and you actually just reach out to people, you'd be impressed at how often they actually connect and you make a real connection. So yes, Molly from the webs.
What hashtags do you listen in on?
Conversations on.
There's times where I go in on Twitter and I will kind of do hashtag healthcare, hashtag health, look at that. I also, I've been part of some of these tweet ups where there's a hashtag around a conversation and you're kind of following some of that, and I'll go in and look at it either after the event's happened or so. So that's how I use hashtags if I'm looking for something specific.
Yeah, same. So, things that we're working on at the Medical Association, opioids is a topic that we're constantly staying up on. Prior authorization is another national conversation that we're having. So those types of priorities that we're focusing on, and when we want to learn from a larger network, we'll put those hashtags in and try to see who's talking about what.
Yeah, I would say most commonly it's around specific events, but beyond that, I would say one I'm following some right now is Unbreak Healthcare. Athena Health has sort of catalyzed that, but I think that's an interesting one. There's one that's FM Revolution for Family Medicine Revolution. I think that reinvigorating primary care is probably the most important priority to sort of get our healthcare system right. And I think that so some of the dialogue around that's interesting and some of the activity there. So I follow that one as well.
Great.
Quadruple.
Yeah. Before we take the next question, I'm going to thank Jennifer because she actually has to leave to go to another meeting. So thank you so much for being here, Jennifer. Yeah. You can tweet her. There's her Twitter account right there. So another question. Here we go.
Thanks. Dawn, so this one's mostly for you. As the leader of a carrier, I'm sure you've had your fair share of customer experience issues with angry tweets from people who weren't happy if a bill wasn't paid or what have you. So how do you approach those? Is it a team effort? Do you work with your communications team, or do you have an engagement strategy?
Yeah, that's a great question. So part of the advantage of being on social media, right, is you're going to get some of that, whether it's my handle or Regence handle. I'll be honest with you, it is rare to get that, but there's things that come up. So whenever that comes up or happens, the beauty of it is you can work quickly on it. So a lot of times people will be surprised. So if it's something that we need somebody to get help with, we can get it to our customer service handle, Regence Help, or Regence Washington handle. We'll get somebody on that, and typically what you see is a response, and Jeremy knows this from sort of setting some of the protocols. We'll have somebody, have them follow and then direct message them so we can kind of set up that private conversation and hopefully resolve the matter, whether it's Twitter, Facebook, anything like that. Now, something like Facebook, where I keep it much more, it's personal connection points. So those are friends. That would be something if it happened on our Regence, Facebook page or something. We get a team of customer service folks on it right away, like you would if you got a call or something, went out into the media in a different way.
All right, we got another one over here. Oh, yeah, right here. Go ahead.
How do you decompress? When I always liked reading the newspaper. I don't no longer read the newspaper, but I liked in the morning having an opportunity to take 5 minutes to read a physical newspaper and sit in the elevator and just kind of clear your thoughts. How do you do that now when you have social media kind of at your beck and call?
Good question. I would say the main thing for me is just exercise, and I try to pick some exercise that demands. Some of the time I confess I'm productive during my exercise, and I will listen to podcasts and things like that. I definitely do that. Guilty as charged. But there's a lot of times where I just go out. That's my kind of quasi meditation. Is just go out there and ideally it's something that demands my attention, like mountain biking or skiing is good because I can't think about work stuff or I'm going to die. And so that's my crutch on how I do that. That's probably the biggest thing. And then just family. I mean, I try to be pretty good about not being the loser dad who's checking his social media while he's, hanging out with the kids. And so that's probably my other piece.
Yeah, similar. I run, exercise, hike, do things like that too. But I guess the other flip side I would say to your question though is I actually don't feel like I need to decompress. There's times where I've used social media, whether it's Periscope or something like that, where I'm watching some gurus talking. What better way to decompress than to hear some of the masters on decompressing or how to solve something? So for me, I try not to and it's just how I operate. I don't worry so much about that. But today's point, exercise is a great way just to get you focused and kind of get you away from electronics and technology. But I don't worry too much about getting disconnected. Actually, I get more agitated or nervous, anxious when I'm not connected and I don't have a connection point.
Get up in the mountains where there's no Wi-Fi, right? Which is easy for us to do up here. So who's next? Yeah, go ahead.
Hi. There's a lot of medical research going on in South Lake Union and Seattle and Hutch and SCCA, and these PIs are in their labs, and sometimes they find interesting findings. What do you recommend as a social media outlet for them at the end of the day to say, does anybody know about this molecule that's having this, strange reaction, or we found some DNA snippets and it looks like this, what have you found that is safe, that is more than 140 characters, because some of this is detailed and you can be misunderstood if you don't give it a good story and put it in context. And that's something that is a little bit disturbing to me, is that 140 doesn't give you much context. They're just arrows out there, and it can be misunderstood. So there's a responsibility with a lot of that communication that is inherent in what you're talking about. But first question is, what's the best tool for a PI to use if he or she wants, at the end of the day, to ask that question?
So not being an expert in this area, if I were giving advice to somebody around that, I would say, who are the experts that you're targeting or the types of folks that you want to target? So for me, I would look at it and go, what's the best tool to do that? It could be LinkedIn, it could be Twitter, whatever, but it's more, I don't think it's about broadcasting out what you found in terms of making a real connection with somebody or an organization or somebody that can help you move something forward. That's how I think about it. So there may be multiple tools, there may be one that's better for that, but that's the advice I would give is figure out ways to do it. It could be picking up the phone and calling somebody. It may not even be social media. So that's how I would look at it.
Yeah, just adding a little bit to that. I mean, I think that the tools are good there to kind of find the people who would be in the tribe that would care. And so engaging and listening with them, before just blasting them right away, I think that's always important. Tools like LinkedIn do give you more than 140 characters. And so, you could tweet something that's 140 characters that links to, your own personal blog or LinkedIn or whatever, where you can go into more detail. So I think you always have that option. It's just the trick is to come up with something crisp in the 140 characters that pulls them in. But I think really begin with listening to other people, and hopefully, I tend to be a believer in, give before you want to get. And so hopefully you're adding value to other people's efforts and responding to them. And I think they're much more likely to respond to you in kind when that moment comes. And be humble enough that, there's incredible things you can learn from other people. And even when you're super busy, and it can be hard to do that, you're sort of making deposits in that bank of karma that will pay off later.
I think there's just to add to this, it is about finding those tribes, about those kind of niche groups and communities that you need to be speaking to. One tool that I've used and we've used is, and it's online, it's open source, it's called the Healthcare Hashtag Project. And it's a group called Simpler that created it, and they have literally hundreds of thousands of hashtags that they track that are all about healthcare, and they get really nuanced and esoteric. So if there's a hashtag out there that speaks to that group, it's probably listed there. And there's other research and things that you can do to try to find those groups. A company that I've seen do this well is Intel. They have a lot of their another area that I know nothing about, but they have all these really smart engineers that they've enabled them with blogs, and then from their blogs they go share it on social media, and they're talking to this group of other engineers that are all about wafer processing and things like that. And so it is about, you know, collecting those tribes and giving them a platform to talk about their art and their craft.
And Simpler is, they're a spelling challenged organization. It's SYMPLUR. So, yeah.
Hi. Do you put any thought about segmenting your followers or your audiences at all, or crafting messages for a particular group of your followers?
I'm pretty low tech on that. And so I mean, I definitely think about different groups, probably more from a sort of content generation perspective, and maybe a little bit hashtag perspective is kind of a, maybe like I mentioned FM revolution. So there's some things like, oh, I think this is particularly relevant to them, so I'll add that hashtag when I tweet about it. And so that's been the main thing. And then just think about, okay, what groups do I want to have some influence on, and what would be interesting to them? What are the issues they're tracking? So it's more organic and sort of listening mode versus the you know, kind of promotion mode, other than the hashtag. I don't do too much beyond that.
Yeah, I think about the segmentation in terms of how I share and what I share. So with if I'm putting something out to LinkedIn, either it's an article that I like or something I've written, you know, I think about that as a sort of professional audience. But if there's something maybe that I've gotten published as an article that makes sense for a real certain group in healthcare, I'll go to one of the groups in LinkedIn and kind of post it there and put it into that. And then Facebook, you know, there's times where I'll, you know, it's me and my kids hiking or something like that. That's going to go to my friends on Facebook. But then there's other times where, you know what, this kind of crosses, you know, personal and professional, and I'll share it on Facebook and then make it global so that it's open up, you know, to anybody that would want to go, you know, look at my profile and see something like that. So I do try to give it some thought about, you know, both the channel tool that I'm sharing it on from a segmentation standpoint, and then the level of how far out I'm sharing it, whether it's more global or more concise to a specific group.
I think that's a good point, Don, too, because it actually reminded me when you put things out global, too. If you haven't Googled yourself lately, Google yourself. And if you're on social media, tweets and some of your posts are now starting to show up in search results. So when you make those public and you have something that is, you know, valuable, and you're adding dialogue to that community, it's just starting to get even more legs. So do we have any other questions? Yeah.
This is for Don, as a follow-up to what you're just saying. So are you saying that you're not syncing up with whoever in the company is responsible for your integrated marketing strategy and their marketing calendar, so you could potentially know whether you're going to release a tweet that maybe distracts from some big announcement that was part of some planned marketing program that somebody in the company already had? Are you just really...
So I'm tied into so there's the Regence sort of handles and property from a social media standpoint, Twitter, Facebook, all of that. So I know what we're posting, how we're doing that, what the strategy is there. I know any kind of significant announcements that would be interacting with Regence in Washington I would know about. But I do, these handles that I have for Twitter or LinkedIn, those are my handles, but it's also, I realize, an extension of the brand of Regence. So I think that goes with somebody in my role, and Dave mentioned this earlier, where that comes into play is, you know, media training, understanding what's okay, what's not okay, when, how. You have to know that in my role, because to your point, if you're not very savvy and you post something out there and get ahead of something or something that's not quite right, that's not a good situation either. I think that I've never run into one of those situations, but it's all about but to your point, if I wasn't tracking what Regence or Cambia Grow's doing, you could look pretty stupid doing something out on your own if there's some kind of disconnect there. So it's important to make sure that you're authentically engaging and putting things out into social media. You know, I gave the example of the articles. There's times where, you know, you want to post an article, but you realize, you know what, it's a good topic, but that may not play well from a Regence perspective because maybe there's a competitor that's highlighted in a bad way or a good way or something that you just like, it doesn't feel right coming from Regence. And because I'm the president of Regence, I probably don't share something like that because, you have to have that mindset on. But that's more internal to me. But I figured out a way to operate. I don't know does that answer your question?
I could talk to that a little bit too, working with marketing and Stratcom and what our brand strategy is, and really one of our major objectives is to empower everybody at Cambia, all 5,000 employees, to be active on social and be able to share. But at the end of the day, it is their account. It is they're going to share whatever they want to share. First Amendment protects that right. That's awesome. And really the content that we'll provide, whether it's Dawn or anybody at Cambia, are suggestions. Hey, we would love for you to share this. This is the good work that's happening at Cambia. Hopefully you're proud of that work, and it'd be great if you shared this on social media. You ultimately have to choose whether that's right for your audience, right? Dawn's audience, while there is a lot of overlap between the Regence Washington audience or Cambia, it's not exclusively that. Right? So, and we kind of recognize that and have that kind of latitude in terms of the content that's being produced. So,
I don't know if you want to have this debate here, but I don't necessarily agree with what you said about it's his account. I mean, especially if it's a publicly traded company, the CEO and the executive team definitely can't just say whatever they want as individuals. Anything that comes out of that is, it's tangled.
and that's this. So his question was, and for those following along, is he doesn't necessarily agree that it's his account. It's the strategy that the company comes up with. So if Don leaves our organization, he takes @Don Antonucci with him. Now, if we had created a handle that was @RegencePrez, and we created it and keep the password, we do also have a right that we could keep that as well if he were to leave. But this one is his, and if he left, he takes that with him. So there's obviously some oversight that we'd want to have there, but that's really how the strategies get developed within an organization. So it's your organization to set up those policies and guidelines in advance. So,
but I think you make a good point, though. If you're a CEO of Cambia is a nonprofit, not publicly traded, but if you're a CEO of a publicly traded company, and I know a lot of CEOs of publicly traded companies that do tweet, they do need to keep that piece in mind. But there are some that are really pushing the envelopes around that too, in what I think is actually a good way. I don't think it's bad, but they also, they know what they're doing. Because if you're out there and you don't know what you're doing, and we've seen the press of things that have happened, whether it's police or other, things that get posted that, it's a bad reflection on the organization. You do have to have that mindset if you're in a position. But if you're in that position, hopefully you have that mindset if you're entering into social media. So.
Yeah. I was going to say, you guys brought up a couple of people, Eric Topol, Zidog, MD, who are active in the health space. And you mentioned people like Jean Leger, and you look at Mark Benioff of Salesforce and Gary Vaynerchuk for VaynerMedia, who are loud. Why don't you think that exists in the healthcare space? Are there people like that who you think maybe healthcare needs to emulate? Are there people in that space, and why? And do you have a list of people from other industries that you are trying to emulate on social media or think should be emulated? Lots of questions all at once.
Yeah, so I'll go first. And then, so I look at everybody in terms, key figures and what they're doing. But when you look at whether it's John Leger or Spencer Raskoff at Zillow, he's another one, does a really nice job with social media. What they're doing is working for them in terms of back to the why, their goals and what they're trying to do. So that, what T-Mobile's trying to do or Zillow's trying to do or what they're trying to do personally is going to be very different probably than somebody, my own personality or what our company's trying to do. So you got to figure out what's going to work and what's going to make sense for you and your organization. And there's pieces that you could take from any one of those that might work. But if you go and try to replicate somebody, I think then you become inauthentic. You're not being yourself. I mean, so I do think there's a big part of this is how comfortable you get in sort of your own guidelines for how you want to use social media. It's going to be different person to person. No, I don't think anybody's using it identically the same. But you know, some of those folks out there, like a T-Mobile, they're really pushing the brand in a different way, and almost being provocative in that way is going to help do that. I don't know that we have the same goals from a healthcare organization standpoint or from a Regence standpoint. That's not what we're trying to accomplish.
Yeah, I mean, I think part of the why is just the nature of healthcare. It's a pretty polite industry. It's a pretty risk-averse industry historically, but at the same time, we know there's major changes that are happening now and will happen over the next decade. And I think that there will be some players. I think probably Jonathan Bush would probably be the one that would be on my mind. That's sort of a Mark Benioff, Leger type. And to the extent they continue to have success, I think people will look at that. They have to find their voice. Not everybody's Jonathan Bush. And I think that was, for me, one of the big challenges was kind of decoupling some of the pure media training, still being very mindful of the minefields and risks. But I used to be much more compartmentalized between my personal and professional life. And I think just society is going through some changes. I used to spend a lot more time hours-wise at the office than I do today, but I probably spend a lot more time working today. And my work stuff gets pulled into my personal stuff gets sometimes pulled into my work day, and certainly work stuff gets pulled into my day and weekend and nights and all that. And so I think those societal norms are shifting, but then it's that voice and what works. And of course, if you're a Benioff, you're a Jonathan Bush, you're a Leger, that you're challenging the status quo, I think that's going to work for them. And they all have their different voice, and not everybody has to be as loud as some of them. And you can be quite provocative without being kind of loud and dropping F-bombs and all that. There's definitely ways to do that.
So I think we're at time now. I was just looking at it. So I want to thank everybody for coming today and all your questions. I think these guys may stick around for a few minutes if you have a few other questions you want to ask offline, or you can always tweet us, right? So handles are up there, and this video I think will be online in the next couple of days as well. So I want to thank everybody for coming. This was a really great conversation, and you guys had lots of great questions. So with that, we'll wrap it up. Thank you guys so much for your insights today.